A lot of vendors say that they provide actionable insights, especially to clinicians. But when you ask clinicians whether or not those insights they're getting are very actionable, you get a meh answer. Well, I wanted to ask this question to my next guest to see how they have overcome this trap. I'm about to sit down with Holly and Kathy from Health Catalyst, and we're going to talk about how they're gathering data from all over the healthcare systems, how they bring all that data together, bring it into a dashboard, and bring it into analytics that are actually useful for clinicians. I can't wait for you to hear what they have to say. Let's get to it. Well, Holly, Kathy, welcome to the program.
Thank you. Thanks for inviting us.
I'm excited to be here at the Health Catalyst booth. Lovely booth, by the way.
Thank you.
And I'm really excited to talk to you about some of the exciting work you're doing here at Health Catalyst. But before we dive into that, Holly, if you can, for our audience, just introduce yourself.
Yeah, sure. My name's Holly Rimmasch. I have been at Health Catalyst for about 14 years. I'm the Chief Clinical Officer and our SVP of Improvement Services. So my team has, like Kathy, who's incredible, does clinical expertise, improvement, financial expertise, and operational improvement. So I come from many years in healthcare in many different roles.
Which means you've seen it all, done it all, right? That's
Yep.
Really, all right.
Yeah, both on the front line as a nurse, all the way to a system level.
Excellent, excellent. And Kathy, how about you?
I'm a nurse. I'm not going to tell you for how many years, but a long, long time. I have been mostly emergency department focused and worked at Intermountain Healthcare for over 30 years before coming to Health Catalyst. I love Health Catalyst because I'm able to help patients at a macro level versus a micro level as a nurse practitioner, one patient at a time. I'm the Senior Vice President for Clinical Improvement and lead a team of nurses who go all over the country and the world to do improvement work.
So it's clear both of you have a passion for this space. What brought you to Health Catalyst?
Well, I think it's the mission. I mean, Kathy, I think that's the same for you. The mission of Health Catalyst has never changed, and that is to do massive improvements. First, we started in the United States, but now we're global. And I think that's what drives our passion. I think that's what drives our technical passion, too.
Right. I think our technical counterparts love to hear what's happening to patients and how they're improving. And so we are a company that really, really does care about improvement. I just remember early on, I was helping a health system in Louisiana with sepsis. And they put a protocol in place that they calculated they saved 3 lives in 2 days. And I was just thrilled. It was such an exciting thing to think that I was making that kind of impact. And we try to share that with all of our clients and our teams, that they really can make a difference. And that's that's our adrenaline, I think.
Yeah. I have an anecdote I'll share, and you can cut it if you want to, but I think, again, as Kathy talked about, everyone cares about improvements. And we had a client that we did sepsis with, and it was within a couple months, I think, 40 lives were saved. And they went to their board meeting, and they sent us the video, which just brings tears to my eyes, actually, just thinking about it, where they had different people come in with a sign that said, "I'm a grandpa, and I was able to see my grandkids go fishing." And that is what really drives us, is that improvement.
But I'm going to start you both off with I think that's a tough question. And that is, if you walk around the exhibit hall here, if you talk to a lot of people, especially on the vendor side, you hear this word actionable insights a lot. And how everyone wants to either provide actionable insights or people want actionable insights. And yet, a lot of times when I talk to clinicians about actionable insights that they're getting, they kind of go, I'm not really getting any. So how have you, through your work at Health Catalyst, kept from falling into that trap of not really providing that actionable insights?
Yeah, I think just a couple thoughts, and then I'd love to hear Kathy's thoughts too. As you think about it, data and analytics are critical, and the technology is critical, but it takes more than that as you look at it. I mean, I think we understand you have best practices, like what are the standards of care? And that's what you need to understand to get actionable insights, right? But you need the data analytics. And then you have this idea of adaptive work and change and all those types of things. And so those have to be integrated to really get improved outcomes or clinicians to understand. So, when we talk about it, we bring together best practices. For instance, we might be looking at heart failure. So we will look at heart failure, and there are a lot of standards, and we've identified care process maps that are best practices. And we measure not only the outcomes and the things that everyone wants to look like, what's readmission rates, but we look at the process steps in that, like what's important, what are the key metrics, because you can't look at every metric, because then we got too many, right? What are the key metrics in this process that we should be measuring? That really gives actual insights. And then the other thing that's really important is that this team needs to feel confidence in the data, and that is one of the most critical things. So, with our applications of Health Catalyst and using Ignite, we bring together that data. We only work in healthcare space. And we understand the definitions, we understand how to organize the data so that when clinicians and administrators are asking those questions, they are the questions they need, right, in order to understand that. So for example, like in sepsis, you go, okay, you have a bundle that you should be doing before. What the team really needs to understand is, when did they get the IV in? When did they get the antibiotic? And they also need to validate that data. So before we start in a process step, they understand the definition, they understand where we're pulling it from. And we were doing a pediatric improvement process at a hospital, and we had asthma for pediatrics is just critical. They come in the ED all the time, it's just, and parents get so tired about it. And this physician that we were working with put $5 on the table and said, I bet that no one has better definition and better data around asthma. And that's what our goal is to try to give them what they need. Kathy, do you have any
So I
additional
would just
thoughts?
add on that everything Holly said is right on. But I find when I work with clinicians, I go in with the data, and then we need to actually flow chart out the processes. And when we do that, then we find the actionable insights that are meaningful to the frontline clinicians. So I think that's the key thing that we do. And our company's very focused not only on data, but improvement.
Yeah, and actually, I think, Kathy, that's a really good point, because maybe one organization, one piece of process is great, but maybe in another organization it's not. So it varies. So that data is so important to be able to focus on, the areas where they have the greatest opportunities, which, okay, now I understand the x-ray is not fast. What do I do to change getting the x-ray there faster?
It really sounds like Health Catalyst has a really nice mixture of best practices as well as lived experience. Some of the things you're talking about, but using the standards that are available, but then adding in some elements from both of your experiences of just being on that front line and to know, yes, the standard's great, but it's actually these two measures here that are the most important, and maybe the most important to surface to someone on the front line.
Yeah, I agree. I mean, as we talk about like care process models, like I can't remember what we used to call the doom loop. Having too much information is
Right.
bad, right? And so what we've had the opportunity to work to many organizations across the country and the world, and looking at, hey, these are the 4 things we should look at to start with, or here's the 2 things we should start look at. Let's talk about what this looks around your process, and to be able to start with something that can be actionable quick, so that people see, improvement. But in order to do, again, that's the infrastructure of like understanding how you bring the data together, bringing AI into those types of things, but letting the clinicians understand where that data came from. I think that is kind of scary to say in some typical benchmarking where they say, hey, you need to improve these processes and this is what you need to do. That might not be the problem.
When I'm working with health systems and clients, they always say to me, so what have other health systems done? And so when you present those actionable insights. For instance, with sepsis, getting antibiotics in on time. How have other systems tackled that? So we bring this wealth of experience with all these different places, and we can share that as well. And we find that very helpful, as do our clients.
Well, Holly, I want to go back to something you mentioned at the start, and that is trusting the data that you're being presented. Without that trust, you really have, why bother, right? And yet, that data comes from so many different places. We have so many silos of data in healthcare, and it's one of the big challenges. How have you and your team at Health Catalyst kind of brought all that information together?
Mm-hmm. Yeah, and it's a great question. I think it's really critical. Again, people understanding how we brought the data together is important. But we bring in clinical data, financial data. We can bring in patient engagement data. We can bring in claims data if you're doing population health. So around each one of these big problems, we've done opportunity analysis in many organizations. And so we'll say, oh, here are the top 10 conditions. Well, we've done those over again. So we've organized that data into structures where we have the data in those components, where we have a map where we know where to look. And often, sometimes there might even be one place, multiple places, I should say, where you chart the same thing. So for instance, one of the projects we did was about C-section rates, and we were looking at the gestational age, how long the baby was in there, and it was charted in 5 places, right? And so one of the things that always happens is we pulled in the 5 places, but the physicians, the nurse practitioners doing that, they're like, they all realized they were doing different places. So part of the process is even understanding how they improve their documentation process and say, we're gonna just pull it from here, and this is the way it's gonna look. And not only did they have 5 places, but they also said, one said in months, others said in days, some said in months and days. So we had no consistency. So as Health Catalyst, we could bring that together and say, yeah, we can make some rules to do it, but it improves the overall process.
So data integrity, as Holly's talking about, sometimes is our very first improvement opportunity. And then I will say at a more granular level, to get clinicians to trust data, and you have one chance, maybe two, but usually just one. We outline very specifically our data validation process. It's statistically significant. We can guarantee if you review so many charts, you're going to have a accuracy of 99% or 90 to 99%. And then at times we ask physicians to do some of their own data validation. And when you do that, then they will buy in.
I really like what you're saying there in the sense that you only get one chance to make that first good impression with data, right?
Yes.
And so, Holly, what you were saying in terms of being transparent of where that data came from, the originating source, I liken it to when you read a paper or an article where someone cites a statistic.
Yeah.
You want to know where it came from.
Right?
We're built that way in healthcare, and so it's not surprising to hear you both talk about needing to do that for clinicians to prove that the data that we're presenting, or that you're presenting through Health Catalyst, is valid. It is what is actually in those originating systems.
Right, and it's the definitions around those data. I mean, like clinically, we're at a conference, we're doing improvement all the time, right? And every year some new thing comes out, and so we better consider putting this medication in to identify the population this year because it's new. That's the stuff that the team needs to validate and verify. We've had many very fun discussions with clinicians where, we came up, and we do have standard definitions, which helps move things faster. But then the question comes down to, well, maybe we should measure both and look about what has an impact, because there's some things that in the process that really don't have a big impact on the outcome. But there's some things, so we learn.
And sometimes one definition means something to one population versus another. I think of length of stay. There's several definitions out there. So presenting the case and educating people, we might use more than one definition and have two different data metrics.
Yeah, I think the other thing, as you asked the original question, what has Health Catalyst done? We've integrated best practices. So we've organized data, but best practices that makes it easier and faster and more automated. But we also have other tools, like we've integrated a level of dictionary ways that people can look it up. Actually, as a nurse, I could do that, right? But we've integrated things like AI into certain areas. And, we work with teams every day to try to figure out how to do that, on how to get insights faster to them. And so I think that Ignite level on some of the things that it can do that we build into the infrastructure has really helped speed up the process to get insights to clinicians and administrators.
But we did pretty well. We made it about halfway through the interview before someone mentioned AI.
Yes.
And I can't do an interview these days without
Well,
actually
of course
talking.
you can't. You can't.
So let's go there. How have you leveraged AI to improve the insights that you're delivering to your customers and to the clinicians at the front?
Yeah. Kathy, you want to start?
So we have two things that come to mind quickly. We have something called Healthcare AI, which is using SPC charts and prediction models, and it takes unwarranted variation and brings it to the forefront. And this is all done using AI. It automatically, as improvements get better, as people make improvements, the actual range shifts, and that's all using healthcare AI. It's a terrific way to help people understand, are they really moving the needle and improving. And then the second thing we're doing that's exciting in my mind is we are identifying through flow charting and looking at data, what are the top things that we could do to get the quickest return. So I'm thinking of heart failure, and we look at a whole bunch of things to prevent readmissions. We look at patients getting the right medications and the right follow-up and whatnot. And so currently we're taking all of those identified opportunities, and they're running algorithms on them and saying, if you do this, you will see this rate reduction in length of stay and this improvement in mortality. And I mean, it's terrific. It's like we don't have to wonder anymore, and we don't have to use somebody's pet project. We can go in and say with authority that, yes, if you, and this is one we've done several times, if you do daily weights every day on your heart failure patients, you're going to improve their length of stay and their readmission rate. So simple, but AI was able to tell us how important that was.
So, in past, we've always, done this improvement work for as long as probably
Forever.
Yeah, for a year, right.
Yeah.
And so that was a human intervention that happened, right? So it would require someone who has expertise, like the question, like, what has everyone else done? Like, we can now integrate that into AI to say, okay, here's your opportunity. Here's some projections of things that you can do. And here's some actually things that you might want to consider doing. So in a way, it's very exciting to us because it's really actually automating some of the work processes and speeding that up. Now, at the end, yeah, you still have to understand what's going in, and what goes in is really important, what comes out. I think I talked about the opportunity analysis. We utilize AI to do that in a much more comprehensive way than we ever could before. We always looked at cost, revenue, variation by physician. We looked at those things that you could normally look at. Now we can look at all of these, socioeconomic components, like, zip codes, all those things in an automated way. And I think the other thing I was going to mention, what do we do in Health Catalyst? We generally look at refreshing 24 hours. Some things are more, so, we're not the EMR in the workflow. We can go back and work with the team and they fix that right. But the teams can look at it, things that they used to ask for their analytics teams, right? They would take a few weeks to iterate it and go through, and sometimes a long time. They can go in there and look at it anytime. It's refreshed and constantly. We have folks that look at it on a daily basis to say, hey, we have a couple people that came in. I need to follow up with them tomorrow, today. So I think we're seeing that AI with the capacity to do much more complex things, automating the process much further, and pretty much checking every parts of the process. And for us, so it's trying to pull out what's the expertise that we're working with the clinicians, with the administrators, but the workflow, the adapt to change and all those things, those are things we're trying to build in AI. Another exciting thing, we just have a product called CCI, which is Clinical Cost Intelligence, which is actually looking at activity-based costs versus in past, a lot of the costing has been, here's the nursing unit, it's a day charge, everything's in there. It's more activity-based costing, and we've actually integrated AI in to do that, to do very similar. So it's looking at it from a clinical perspective, not only a costing perspective. Here's a costing perspective, but here's now clinical. So that idea of integrating this with AI has become something that's been much more doable, much more manual in the past.
Holly, you went there. This near real time, making sure that the data that people are seeing is relevant and very close to, and not weeks later. How important is that? I mean, what have you seen teams be able to do when they're able to see themselves and the impact that they're having that quickly, as opposed to waiting, the weeks for the analytic department to give them that data?
So I'm thinking of sepsis, and I'm thinking of CMS data that is months behind. Sometimes it takes a long time to abstract. In sepsis, in most of our accelerators, we have a 24-hour turnaround. And so if I'm a sepsis coordinator in a health system, I can look within 24 hours at someone who was in the ED yesterday with sepsis. I can see when their antibiotic was started, when their fluids were started, how much fluid they got, what was their lactate, what was their length of stay, was their order set, was the sepsis order set followed? And I can go right to that provider and that nurse and say, here's how you did. It's huge. Versus someone 2 months later is not going to remember that case like they did the day before.
Well, and these teams that are meeting about the multidisciplinary teams, because in order to do improvement process almost anywhere, even if it's costing or revenue, it's multidisciplinary. But you've got, clinicians, you've got folks who are doing data and analytics, but you have, physicians, nurses, depending on the process, could be the physical therapist. They're, in order to keep these improvements happening, they're looking at this data on just a constant basis. And that kind of improvement really makes a big end. I mean, we have on our website, I was just looking, I think about $2.2 billion that's savings, right? If you put these together in our published stories, we have thousands of others. But like Kathy, for example, at one of our clients, when we worked on sepsis and heart failure, I think we had more importantly, about 600 lives saved.
It was significant, and days at home, getting people out sooner so they could go home. And this is a large health system. We've impacted or worked with about 20 hospitals in this health system, and we have several nurses from my team who are working specifically with these different hospitals, and they have standard metrics and a standard dashboard, and they're going in and leading improvement work with all these teams, and it makes a difference.
So I think, we always try to measure life saved, but, as part of the process of understanding closing care gaps, right, there's probably millions of patients who've been, involved in this who have improved. Again, it could be days at home, it could be improved health.
Right.
But almost everything is that value equation. We measure the financial piece, and that's how we got to 2.2 billion as the ones that have been published. And I think as we work with our clients, another important aspect is we work with their finance. And before we start, we try to understand what that baseline is and the improvements, so that it's an internal way to improve and share the incredible work that teams have done with both the patients and save lives and the finance part. And that's important because you have to be able to fund things like data and analytics, these teams moving along, and that looking at their return on investment is critical, I think, in this process, and data and analytics really can help us do that.
If I could ask, you mentioned the impact on patients, you mentioned the impact that your work has had on the organizations. What's the impact been on the clinicians who are using your system?
I would like to think they have increased job satisfaction because they are actually involved in the care, and we are listening to them and following their suggestions, and they're the ones that are coming up with these innovative, amazing things. When I go in to help a system, I always come in with a list of interventions. Well, you could do this, this, or this. And I used to be hurt because the interventions were never what I suggested. But what has happened is these clinicians are so thoughtful and so passionate about caring, and they come up with really great ways to improve care, and we institute those and we see big results.
Yeah, and I think, clinicians and actually administrators, people in healthcare, I mean, they want to do the best they can. And I think they face these, situations every day. And I think they feel good about it. And we do think it does improve their satisfaction as we go through. And we have incredible champions. And sometimes we start with people who aren't really excited to do this, right? But like I was telling about the physician who talked about, here's the best. He wasn't a physician who was excited to start that, but he saw the opportunities. And I think everyone understands we have to work towards that value care. Healthcare is expensive, and we want to make sure everyone is equitable.
Well, that almost kind of closes the loop from how we started, right?
Mm-hmm.
We started talking about the trust and the data, gathering that data, but then actually showing those results and then kind of reinforcing
and celebrating it.
Right.
Just starts to build what we like to call it is the improvement wheel. You start doing it, you learn about it, you do it, and then it starts to swirl, and it gets better, and it gets better for patients, for clinicians, for administrators. It gets better for everybody.
One thing that I love about Health Catalyst and the data and the dashboards we bring is that we get sustainability.
Mm-hmm.
We can follow a process and improvement for years if we need to, at least for 12 months. And we're able to say, you're doing well, you need to do better. I mean, right away we can share that information. And so sustainability and diffusion are, I think, one of our big selling points.
Well, Holly, Kathy, it's been wonderful to have you on the program. My final question for both of you, where can people go to learn more about Health Catalyst?
Well, we're on the web, so we have a site, healthcatalyst.com. They certainly can go there. They can reach out to us specifically if they have clinical questions, but we have a lot of expertise in technology, data and analytics, and we do a lot of things. So, that's probably the best place.
Well, Kathy, Holly, thank you so much for your time and sharing that great information with me. It's been wonderful to have you. Look forward to the next one.
Thank you.
Thank you.
Hey, I really want to thank Kathy and Holly for hopping on camera with me and sharing their passion for this industry and for their work here at Health Catalyst. It's very clear that they're very proud and very grateful for the impact that they've been able to have on clinicians and their customers in terms of lives saved, the economic impact, and just the fact that they're motivating and creating that virtuous cycle of allowing clinicians to really improve the care that they provide. I thought it was exceedingly cool. I'm Colin Hung. Thanks for watching, and I'll catch you on the next video.